Hello everyone. Today my topic is 3D ultrasound imaging for assessment of scoliosis. I'm from Hong Kong Polytechnic University, Department of Biomedical Engineering. Adolescent idiopathic scoliosis has been very common among kids. The X-ray cup angle is the gold standard for the clinical assessment. However, X-ray has a radiation hazard, and also it provides only 2D information about the spine rather than the 3D. But the scoliosis itself is a 3D deformity. Throughout the scoliosis diagnosis and management, there's a lot of time that we need X-ray assessment in current clinical practice. Therefore, the accumulated X-ray dose is quite significant for the kids with scoliosis during their adolescent stage. There's many reports showed that X-ray actually can have some impact for the cancer prevalence. So in this Denmark study, it has been shown that for 17 X-ray imaging during the adolescent stage can have an impact of 4.8 times higher cancer prevalence after 25 years in comparison with their age-matched group. So because of these radiation issues, so there's a lot of ways we try to avoid X-ray, and one method is the surface imaging with optical and also some mechanical methods to measure the angle, as well as to understand the deformity of the spine. And some system even can provide a 3D model of the spine. However, we know the information on the back cannot totally represent the bony deformity inside the body. So therefore, it can be used for screening or in some other cases like monitoring of the progress, but this only roughly, not accurate. We can use MRI or CT to obtain the accurate 3D imaging for spine. For CT, it has radiation, but for MRI it does not. But both are requiring the subject to be lying down, and that will significantly change the natural deformity when the subject is understanding. So therefore, that is not routinely used for diagnosis for scoliosis, but during the surgery or before the surgery, the subject will be scanned using MRI or CT. One commonly used method nowadays is the biplanar X-ray imaging, like EOS system. It can form the 3D model, but again, this is not a real imaging, it's a modeling method. 3D ultrasound has been used commonly in medical field, including fetus assessment, heart assessment, as well as breast cancer assessment. So we can think about that. If we can have the 3D imaging of spine, then we are able to form some useful information of the spine deformity. My team has been starting on the 3D ultrasound imaging for musculoskeletal system since 2002. So in the very beginning, we focused on limbs and different body parts. And one of them is for the spine. So that is a B-mode image of the spine, and you can see some features like the spinous process on the top, and also some other laminar information or even transverse process information. So if we can scan over the whole spine, then we'll see this video. So from the bottom to the neck, so we can see gradually we can scan over the whole spine to form this 3D information. So with that, our team has developed a method that can provide the image of spine, the bony structures. But this is in some way a breakthrough because ultrasound is normally, as we shown earlier, is looking or viewing soft tissues. But in this device, we use ultrasound to view the bony structures. So the technique we use here is obtain the 2D information together with it's a spatial information. So stacked together, we have the 3D volumetric information. Then using some image processing method, here we will use the volume projection imaging method to form an X-ray-like image, like shown in the most right side. This is a demo showing how the coronal image of spine is being obtained in real time while the probe is being scanned over the spine. So we can go through different depths to see the information. The here very, very important concept is the information shown here is mainly the shadow of bone. So we use the shadow of bone to represent the bony structure. So that is the novel idea in this system. Of course, we can get the 3D information as well. This we'll introduce later. So with this idea, we started with a concept, and ultimately with different industrial supports, we finally become a device called a Scoliosis. So even we now in 2021, we have a portable device. So this is a typical image obtained by the this system for scoliosis subject with different deformity. And you can see the bony features as shown here to represent the degree of deformity. And we have conducted quite a number of studies to demonstrate its feasibility, validity, and repeatability. So this study shows that if we use the lateral features for the measurement, just like X-ray, so the ultrasound measured angle is very, very well correlated with X-ray measured angle. We have also developed different methods for automatic measurement. So this is one method. We can see that automatically detect the lateral information and then automatically gather the deformity of the spine. And this using the portable ultrasound system, as shown here, a probe with a computer notebook or a tablet, we are able to form this 3D ultrasound information system. And then the accuracy has been verified similar to the big machine. And this is the image obtained by the portable device. And we can also conduct automatic measurement using this device. In addition to coronal view imaging, the system can provide the sagittal view imaging just using the one scan. So this is one report we have published and showing how the sagittal plane angle actually coupled with the progression in the coronal. And for the axial rotation, that is X-ray actually cannot provide, and ultrasound, since it's 3D, we can also provide its information using the bony features. So this is a comparison study with EOS provided information. And their correlation is very well for the axial angle measurement. Since the information we obtain using X-ray, using ultrasound, it is in a real 3D information. So therefore, we are able to get the 3D information of the spine. So this case shows how we obtain the information from 2D and also from 3D. Ultimately, we can have a 3D modeling. And for this modeling, the posterior part of the spine is real, the information. But the anterior part, ultrasound cannot see. So this is a modeling effect. So in summary, the ultrasound method in comparison to X-ray has a radiation method and radiation-free features, but in comparison with surface topography, the method, it is more accurate. And ultrasound can also provide muscle information, and that cannot be provided by X-ray or any other surface topography method. We are having a project going on, that is to provide progression prediction using the 3D informations. So the project is going on. We hope we can share the information and the result with all of you in the near future. Finally, the 3D ultrasound imaging system can contribute to the whole process of scoliosis management cycles, starting from the accurate screening, mass screening, continuous monitoring of progression, and even the progression prediction using the 3D information of one scan or multiple scans. Treatment outcome measurement, as well as real-time visual feedback during non-surgical treatment, such as exercise-based, so that to make sure that the internal structure is as what we expect during the exercises. Thank you very much for your attention.